Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, which is dedicated to discussing important healthcare topics of interest to our community. Today, I'll be talking to NMC's Chief Financial Officer, Chris Hickey, and we're going to talk about the recently submitted budget for 2018 and the effect of payment reform on hospitals. Now that's exciting.
It's always a riveting topic.
I can't wait.
Absolutely.
So Chris, thank you for joining this show.
Sure.
So just for our audience, maybe introduce yourself,
Sure.
who you are, how long you've been at NMC, and then we'll jump right into the budget.
Sounds good. Well, I've had the pleasure to be here at NMC for the last 18 months. Time flies when you're having fun. I think that's always the key adage. But yeah, I've got over 35 years experience in healthcare in both New York State as well as Massachusetts, and I was privileged to come here last January. So I think I'm heading in month number 19. So not that we usually count in months. Sooner or later I'll stop and I'll start counting in years instead of months.
That's great. And you've been a fantastic addition
Thank
to
you.
NMC. So the timing has been great, hopefully for you and definitely for us.
Absolutely.
And Vermont is an interesting state
Yeah.
to be a hospital CFO.
That's for sure. Yeah, when I came here, I was always, coming from New York, think New York's one of the most highly regulated states in the country, and I think Vermont gives it a very good run for its money.
Oh, wow. That's the place we want to be, right?
Yeah, exactly.
So what is the process in preparing a budget for a hospital, and where are we at in that process?
Yeah, well, the budget process actually starts back in February. That's how long the process is. And we start out by working with our department leaders and physician leadership in looking at what are our volumes going to be? You know, who is it? You know, what type of patients? What type of services are we going to provide? And then once we do that, we begin to then build what needs to support that. What needs to support that volume? What's the staffing levels? What's the supply expense we need? What facilities do we need? And we kind of do the whole process, and it includes two major components: a capital budget, which is purchasing equipment, or buildings, which obviously we're doing, and also you know, any type of things that we need to support those services that we're providing. And then the second piece is the operating budget, which is the staff, the supplies, and all of that. So it's two major components of the budget: a capital and an operating component.
And what are some of the things that for 2018 that you're having to think about? Because it's not a budget as usual, especially with the payment reform. So what are some of the things that you're thinking about differently, maybe?
Yeah, we've just finished the process. Actually, it was just approved by our board recently, and you know, this year has been exceptionally challenging, and primarily because of a significant number of outside influences this year. I think there's always outside influences in healthcare, but this year I think there were so many moving parts, and continue to be so many moving parts in terms of the budget process. You know, we've had some issues with the state in terms of funding for some of the services that we provide, called disproportionate share funding. And that's a funding component that our hospital has been benefited to the tune of $1.8 million over the last few years. And the state has taken some of that money from us to redirect to other critical needs of the state. Now, totally understand how the state does that and why the state needs to do that, but it creates a hole for us. Sure. In terms of our budget. The hole that we expect this year is, you know, close to $600,000 in terms of what the actual impact on our budget is. So that's an influence in terms of what's happening at the state level government. And that's just an example. There's a lot of things, as we all know, happening on the federal level. Right. You know, with the constant back and forth in relationship to the repeal of the Accountable Care Act, or Obamacare. Right. You know, just trying to understand that and trying to understand what it means to the budget. What does it mean? What is it going to mean to us in 2018? So we're trying to predict the future. Right. You know, the biggest challenge of budgeting is trying to predict the future when there's so many moving parts. Is accountable care going to be repealed or not? What's it going to look like when it's repealed? Who's going to be covered? Who's not going to be covered? I think the biggest impact for us on the Accountable Care Act is really the potential impact it has on our bad debt and what we call our bad debt and charity care. Those that are unable to afford their services. And we do a very good job as an organization providing charity care to our community, those that can't afford to pay for their health services. And with less and less people potentially covered, I use the word potentially because the debate on the federal level is who's going to be and who's not going to be covered. And the state of Vermont, I think, is ahead of the game in relationship to that anyways, but still there's impact to us. And then the last piece really in terms of three external factors, state, federal, is payment reform, which is both a state and a federal issue, but it's very accelerated here in Vermont from other states in the country.
Wow.
Sorry.
I hope you got all that. But so let's talk about Accountable Care Organization, because that is a vehicle as well, where as far as payment is concerned. So what's an Accountable Care Organization, and what are some of the things that we're participating in?
Sure. No, accountable care organizations are vehicles that really are being developed across the country to really do what the term says, make people accountable for care and make organizations accountable for care. In the state of Vermont, there has been 3 accountable care organizations. One called Health First, which is really physician-based. It's it's independent physician practices for the most part, not completely, but for the most part. There's what they call CHAC, Community Health Accountable Care, which is primarily federally qualified health center based. Okay, so health centers across, for us it's Notch, and there's federally qualified health centers across the state. And they have an accountable care organization that supports them. And then the large one is OneCare, OneCare Vermont, which is really primarily hospital-based, but it also has physician participants as well. And they're a vehicle to help kind of channel reimbursement and revenue to hospitals. And the major change that's happening right now, and really is happening in 2017, but will really be expanded in 2018, is payment reform and the changing in payment through the accountable care organizations to hospitals, which is completely different from what hospitals have been accustomed to be reimbursed at. It's based on a methodology called capitation. Okay, and capitated is really a term to say, as it implies, it's a capped payment. It's a flat payment. You know what the payment's going to be, and it's really moving from a fee for service. So we historically have gotten paid every time we've done something, a lab test, an imaging test, a surgery, all aspects of the hospital. And now they're going to say, I'm going to give you a flat amount of money every month to treat Chris or Jill, and it doesn't matter what you do in that. You're going to get that capped amount of payment. It's a methodology that's been used across the country. It's kind of come and gone a couple times over the last 10 to 15 years in various areas of the country. And we've been operating under that for a small component of our business since January 1st.
Yeah, part of a pilot?
Yes, the pilot program is called Vermont Medicaid Next Gen, and it's an agreement between OneCare and the state of Vermont to provide capitated services to a subset of our Medicaid population. Okay, for us it's about 3,600 lives. In a capitated environment, the key term is lives because it's individuals. It's one person that you're covering, and you get a flat amount for that person on a monthly basis. So we've been doing this pilot with 3 other hospitals in the state, total of 4, us and UVM Porter Medical in Middlebury and Central Vermont Medical Center in Berlin. Have been 4 hospitals that have been working under this capitated model for this year. And it's too early to tell
Sure.
its impact, and that's another issue from a budget perspective, is the uncertainty of how we've been doing under this model. So about 3,600 lives for us, about 30,000 across the state. Now in 2018, that's going to expand from just Medicaid lives to include Medicare lives and also Blue Cross lives, because Blue Cross is looking to participate in this. So statewide, the number is going to go from 30,000 lives to about 140,000 lives. And for NMC, it's going to go from 3,600 lives to about 12,000 lives.
Big difference,
So it's a
yeah.
big difference. So it's a big component of our business. Medicare and Medicaid, to give you an idea, is about 59% of our business is between those two payers. So it's a pretty substantial number of people.
Absolutely.
The goal from the state's perspective in terms of this is to eventually, and its work with the federal government, is to eventually get about 75% of people somehow reimbursed under an alternative payment methodology called capitation.
Capitation, yeah. So how do you survive under capitation? So what types of things is NMC doing that will move us into a healthy place under a capitated system?
Yeah, there's a couple of, there's many initiatives that we have that is preparing NMC for that world. We're in it already.
We are, yeah.
But it's a moving target in terms of preparing for it. The first is, a significant investment in healthy living. And healthy lifestyles, and that whole piece. Rise Vermont, as I know you've had many people on your show for Rise Vermont.
Yes.
That's a real key part, because the importance of capitation is keep people well so that they don't need the acute care services.
Prevent chronic
It's
condition.
much cheaper
yeah.
to treat a well person than it is to treat a sick person. So that's the first thing, is invest in wellness. The second piece is cost management, which is always a challenge, and making sure that you've got the right number of people, the right number of resources to treat the services that you need to provide. And we constantly, as a management team, are reviewing how many people we have. Do we have the right number of component of people? And we benchmark ourselves against national metrics in terms of how many people we have. Very important component as we set the budget is how do we know how many people you need in each department? So that's going to be increasingly critical in relationship to capitation. The ultimate goal of capitation is to bend the cost curve, make healthcare more affordable. The only way it's going to be more affordable is to continue to reduce costs and find a way to make healthcare as efficient as possible.
So you talked about the hospital board approved the budget.
Yeah.
Is there any other steps to finalizing the budget for 2018?
Yeah, absolutely. After we get our board approval, then we submit it and have submitted it to the Green Mountain Care Board.
Okay.
Now, I know I could probably go on for 5 minutes talking about Green Mountain Care Board. I know we don't have the time to do that. But, the Green Mountain Care Board is a group of 5 individuals whose main responsibilities really, or one of their primary responsibilities, is to approve hospital budgets. So we submit it to them, and then later this summer, we'll go and do a presentation and, really, explain to the Green Mountain Care Board how all these outside influences that we just talked about affect our budget, and why we feel our budget is a very good budget for the residents of Franklin and Grand Isle County.
Great. So as our time comes to a close, it's been really helpful, by the way, to take everything that you're working on and simplifying it for us. But what keeps a CFO of a hospital in Vermont up at night?
I think it harkens back to the outside influences.
Yeah.
It's the things you can't control.
Yeah.
I mean, if we can control our destiny, and that's I was was going to use the word easy. I know it's not easy. It's never easy. Healthcare is never easy. But the things that keep you up at night is not knowing what's going to happen next. I mean, we've got a surgery center, issue that's looming for the hospital that I haven't mentioned. What's going to happen with that, and how is it going to impact us, and how do we react to how that impacts us? It's all a matter of anticipating, preparing for the changes. So what keeps me up at night is trying to figure out, are we missing anything in terms of what's going to happen so we can prepare for it appropriately.
And in this, I'm hoping you have a chance to balance your life too. You've got a lot on your plate,
yeah,
so hopefully
absolutely.
you get to do some active play. This Rise Vermont you talked about. We got to practice what we're preaching to the community,
I
right?
got to get out there, exercise. That's what it's all about.
Well, Chris, thank you very much for being on the show and helping us understand how a hospital budget works. So
Absolutely.
Greatly appreciate
Thanks
that.
for having me.
Yeah. I'm Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the Health Beat Show. And the hospital budgeting is not easy, but I will tell you that NMC has prepared well. We've got an incredible community board that's guiding us for our future, and we're going to be here for the long time to come serving this community. Thank you.